Hey, it's Dr. Allen here at Evolve Chiropractic in Woodstock. I'm going to show you how to use this massage gun on your lower extremities. So we're going to be focusing mostly on the feet, calf, shins, and we're going to get into the quadricep group a little bit and your adductors. So when you start using these tools, the important thing is that you have the proper little nub on the top here. When we're using these for lower extremity, I like to use either the medium-sized ball or a larger one. Maybe you only have one of these little ball formations, which is totally fine. I wouldn't use like the fork, right? These things are typically designed to go along the spine. Or the flat one would be okay, but we're gonna get just a broad surface contact, and we're gonna use the ball to start. So we'll get that set up in there. And when I turn this on, I'm gonna go up to the highest setting I can get this on. Now when this is higher up, I'm going to now just scan tissue. So we can start on the bottom of the foot, and you're gonna work right through the ball of the foot and down into the heel. So when I scan, I'm doing kind of like a fan shape. So when we're working with plantar fascia or the muscles in the bottom of the foot, they insert kind of on the heel here and they go up into each one of the toes. So you're going to use that scanning. Now as I'm scanning, I'm feeling for anywhere that's kind of sore, achy, dull, and right about there. Usually in that arch of the foot is where we'll find most of it. So when I find a good point, I'm going to slow this down a little bit. We're going to go right into that point there. Now while I'm here, I'm going to actually start to open and close the tissue. So I'm going to take my larger toe and I'm going to pull open as I work into that point. Now you don't want to spend more than 1 to 2 minutes on one specific point. If you spend too much time, you could end up bruising the tissue and then you're not going to be able to continue treatment with that the next day. So typically speaking, these types of treatments are best done frequently, but for short duration. So about a minute or two on one point. Good. Now you might find 2 or 3 points that are tender as you're working through. Sometimes on the outer edge of the foot, kind of right underneath that metatarsal bone right through here. So I find a little tender point there. Again, I'm going to lower down the speed a little bit and we're going to work right into that area. And while I'm there, I'm going to just open, bend my toes back, let them curl forward. Just like that. Now we're going to move this up and into our calf region. So I'm going to try to stay in this position where I'm at here. If you have difficulty getting your leg up to this position, you can always just rest it off to the side. You may even need to use like a yoga block or something like that to just support the leg here. Whatever is comfortable for you, where you can sit in this position and you're not stressing your joints while you're seated. So let's go ahead and scan. So when we do the back part of the leg or your calf, you want to start around the Achilles tendon here, and that's going to come all the way up behind the knee. Now you have to be careful behind the knee itself, the popliteal region is called. There are nerves, arteries, and veins that pass through that area, so you never really want to go too deep into that region. Now when you're here, you're going to try to work on the outside of the Achilles tendon and all the way up towards the knee. And then you go to the middle, and then the inside. So again, we're just scanning, and I'm trying to find areas of particular soreness, achiness. Nothing should be sharp, shooting, nothing like that. It should just feel kind of like a dull, achy sensation. I'm getting one right about here in my mid-calf. There's another one in the soleus muscle, which is the one kind of down here. That's your primary mover when we're walking, or you do any kind of toe raises. That's the primary mover of that movement of, it's called plantar flexion of the ankle. Right in there. So we're going to lower the speed a little bit. Again, we're just going to isolate that one point. And while I'm there, I'm going to do my movement of my ankle. So I'm going to go into plantar flexion and dorsiflexion and just go back and forth between those two movements. Again, nothing should be painful, nothing sharp, nothing pinching. Good, and I can kind of work down. I felt a little more tender point right next to the Achilles tendon there. And you're only spending, again, 1 to 2 minutes. It's not a whole lot of time. We're just creating some stimulation in that area, and then we can move on to the next one. So the other point I found was that gastroc point, the medial head right here. And even here, I'm going to point and flex. Now you could try to straighten your leg on this one because that's going to put a little more tension into that muscle particularly. And you're just moving through that range of motion. Good. All right, very good. Now you don't want to be working on bone. If you ever hit bone, it's going to make this tapping sound and the machine's going to start shaking like crazy. Not a good idea to work over bone. It's not going to feel good, number one. Number two, you could actually create some bruising along that area. So if you are working with this tool and you get on something that starts bouncing on you like this, just move back to the muscle. All right, so we got our plantar fascia work. We've moved up into that posterior chain, into the soleus and the gastroc muscle. Now we're going to go into our quadricep group. Now with the quadricep, we're going to have your outer portion, the lateral side, we're going to have the middle, and then an inner side. And then we're going to have our adductors, which are kind of along the side here that go up into like the groin region. We're going to start with just scanning. We're going to go on the lateral side. So as we're working this, it can get pretty tender down to where the knee is here. You have your IT band that inserts right about there, and that's a pretty sore spot for a lot of people, especially if you do running or anything like that. You're working on your feet all day. These can be pretty tender. So go light. So these tools are pressure dependent. So the harder I push, the more intense that vibration is going to be. So if it doesn't feel good or if it feels too intense, just relieve that pressure. Let the machine do most of the work. We're just scanning. That lateral side is pretty tender, pretty sore right about there. So that's going to be a spot I'm going to focus on. A lot of times up into the hip, it can be a little tender as well. Mid belly, I found a little point there. Just finding points all over the place here. Now the inner side, and with the knee, you'll have like that little ball of muscle right to the inside of the kneecap. That's your vastus medialis. We're going to work on that a little bit. That's a little tender. We're going to follow that up towards the hip bone. Good. Now from there I can go into the inner side. This is a pretty sore spot as well for a lot of people. And usually about mid-belly is where the tenderness will be located. And again, we're just scanning, we're getting some blood flow going, trying to isolate where those tight, restricted areas are going to be. Yeah, so right about there. So we're going to start on the adductor. I'm going to bring that pressure down quite a bit. We're going to isolate right here. So with my adductor, what I'm going to do is just move my leg in and then out. And I can do that with my leg bent here. And that's going to stretch the tissue and then shorten the tissue. So we're just trying to get a little bit of movement with the vibration to help open that tissue up a little bit better. Good. Again, maybe 1-2 minutes max. Nothing should be sharp. Nothing should be shooting. If it is, you might be on a nerve or an artery, so just shift the contact a little bit. And it should feel like that kind of dull, achy. Sometimes with the vibration, it can almost be like tickly feeling, which pain and tickle, they go along similar pathways in the nervous system. So that could be just like an ache that you're feeling, but it just feels kind of like a tickle. And as you work the vibration through that, that tickle should start to change to a bit of an ache. Good. All right, we're going to come up into that lateral side here. Now with this one, I'm going to put a little block underneath here. So what I'm going to do is just lift my heel up and bring it down. I'm going to focus right on that point, right above my knee. Lift up and back down. So I'm engaging the muscle and then relaxing the muscle. And as you relax, sometimes you can get in a little deeper with it. Again, you should not be pushing so hard that the gun starts to vibrate or shake like that. You just want to let the machine do the work. It shouldn't be a super intense sensation. It should feel good. Good. I had a little point up at the hip here. And just similar movement. All right. So we've worked pretty much through the bottom of the foot, calf, into the quadriceps, adductor group. We're going to get into the front of the shin a little bit here, into what's called the tibialis muscle. So what we're going to start with is our higher speed. Now this one you're going to start along the outer aspect of the shin, and you're going to come all the way up to where this little bump is on the knee. So you're going to follow all the way through. Now your shin bone creates a little crease right in the front. So again, if you hit that, you're going to know pretty much right away. You don't want to be on the bone, just right next to it. And now we're just going to scan. Now as I come out to the outer side, there's going to be another bone. There's a little knob right up here. That's your fibula head. And you don't want to go hard over that one. That's going to be pretty tender. But you can go just along that bone, because muscle actually wraps over that bone. You can actually work over it. Now this can be a site of pretty sore muscles, especially if like you're a runner or you get shin splints. This is a great technique to work and find those adhesions along that muscle that are creating that irritation with excessive movements. All right about there I'm finding something, so I'm going to lower my speed. We're going to isolate that one point. Now as I go through this one, I'm just going to go into dorsiflexion and plantar flexion, just like that. Again, 1 to 2 minutes on the sore spots. Now if you're more on the outer side, you'll feel some going into dorsi and plantar flexion. What you might want to do is actually roll your foot inward and then outward. And that'll activate that lateral aspect of the shin a little bit better. Awesome. Sometimes your ankle will start to pop or crack as you're loosening these muscles up. Totally fine, as long as it's not a sharp or painful movement. So just be aware of how far you're going with these movements. You don't want to push all the way into an end range and hurt your ankle. Just move mindfully. Awesome. So that's a pretty successful treatment. We worked pretty much all the way through. Now you could just do, like at the end of that session, just some gentle strokes coming from the ankle all the way up towards the hip. So this is used more for like lymphatic drainage. If you get swelling in your legs, this is a great way to push fluid and move through. And you're going to work the inside and the outside of that. Just be careful as you go over the bony structures here. You're just going to lighten up your pressure and then come back up. And you can do maybe like 5 to 10 repetitions, and you're primarily going from the bottom up. So whenever you're working with swelling or anything like that, you always want to push fluid up towards the heart. Perfect. So that's a great introduction for the lower extremity. Be safe with this thing. Like I said, you can definitely over-treat with these massage guns and create more problems than you intend to. So as you're doing it, just go light, go slow. Man, my leg feels way different than the other one. I'll be walking around in circles. I'm gonna have to treat this other one like right now. So have fun with these. Not too much fun. Be careful, be safe, have fun, get at it, and I'll see you soon.